We're in the theatre this morning, basically just with a setup of brachytherapy that we use for prostate cancer. So we can go into the detail of what we use brachytherapy for, but it is for localized disease that we need to treat the prostate, obviously. The setup basically looks like this. All it's missing is a patient, and then we could get going with the procedure itself. The basic idea behind all of this is that we need to get radioactive seeds into the prostate in a specific area so that we cover the prostate without burning or damaging normal tissues. So how we do that is we work on a three-dimensional planning system. Firstly, the patient will be set up on the bed, a little bit of an uncomfortable position because we have to get the legs up nice and high in the air. This opens up the perineum because we have to get the needle through the perineum into the prostate. What you see here then is the ultrasound, the stepper, and the arm the stabilizing arm. This is a very mobile piece of equipment. We can move around, and then we would place the ultrasound, it's a rectal ultrasound, in the right position. This then correlates with the picture. This is the ultrasound picture itself, and this is then transferred to the planning computer. Now this is a previous patient's ultrasound. Obviously don't have a patient here. In effect, what we do then is we capture the prostate, so the ultrasound can move in certain directions and it's got different visions as well. So in a actual vision, so cutting it up like a loaf of bread, we can then capture the prostate in its different settings. This would correlate to what we see here. So we can go through the prostate, and what we then do is what you see here, the red line would be the prostate that was drawn in. The green would be the urethra that runs right through the center. At the back is the rectum, then glue. And then three-dimensionally we've got the prostate on there. We then use this to plan the treatment. Now, what you can see is all those green dots are where the needles should be to get into the right position, and then drop seeds within that needle in certain areas. Once we have the plan, then we can transfer that to the patient. So now we go back to the patient. You can see above the ultrasound is a grid. That grid correlates with the grid on the ultrasound and obviously the grid on the planning computer. If we know that we need a needle in C2, we can go through here C2, put the needle in. On the ultrasound we can see that it ends up in the right position. We can maneuver it a little bit to get it exactly in the right place, and then we put all the needles in. Typically 14 to 16 needles are used per session. Once this is done, we change the view of the ultrasound. So now we look at it longitudinally. Then what we can do is we can see the needle as the full length of the needle, and then we can start placing the seeds. So if we know that in one needle we need a seed in the tip, we need one in the middle, and we need one at the end of the prostate, we know where to put it, and we can see it longitudinally on the ultrasound. What we do then is there's a needle in here. We then connect the MIC applicator to the needle, and you can see it's got a plunger. Here it's got space for the cartridge, and it's a spring cartridge, so it pushes the seeds down. So this is what it looks like. You can physically see the seeds in there. And there's a spring system on, so you slot it in there. You attach it to the needle, and then you can push with the plunger, and the seed will drop out at the end of the needle. And you go through that needle, you place all the seeds, and then you go to the next needle. The procedure takes around about an hour, and then it's done. So we go needle to needle to needle. At the end of everything, we look at the plan again on the computer. And we can look at the coverage, three-dimensionally, of the prostate. And if we're happy, we stop. If we need to do more, we can put in extra needles and drop more seeds.